Hi, I'm Pat McGuinness. Welcome to Sky High Coaching, LLC. Today we're going to talk about EMDR, what it is, how it works, and even a little bit about why it works. But EMDR is a 12-step procedure used in mental health counseling, psychotherapy, and it's used primarily to address the symptoms of post-traumatic stress or other overwhelming life experiences. So when some event that you experience is so intense that it overwhelms your nervous system and kind of short circuits things a little bit, a lot of times we'll have lasting anxiety and other psychological problems from these experiences. And so what EMDR is a procedure that was developed by a psychologist in the 80s from California who, Dr. Francine Shapiro. She discovered that eye movements paired with your thoughts, your ruminations about the difficult events tends to help people get relief, and the relief is lasting relief. And so that's what it is. And how it works is, well, we identify the event that caused the problems and the problems themselves. We measure them, and then we go back to the event, and it's in a form of exposure therapy, which means you go back and you basically relive the experience in your therapist's office, and in that process you heal from the difficult effects that you're now suffering from, right? So how it works is we call up the event, we isolate the event, and we kind of slice it up into different parts. Like usually there's a negative belief about yourself associated with the event. Things like I'm not good enough is probably the most common, or I don't matter, or it's my fault, I deserve it. All of these beliefs that maybe at first glance seem irrational, but what we take for granted sometimes is they're there and they show up automatically in your subconscious. And if you're not even aware of it, they're still there, and they cause some problems. Because you think about that, if you walk into a situation and your preset belief going into the situation is I'm not good enough, think about how that might impact your interactions or your ability to take care of business, right? As compared to if you walk in, you're really confident and you're saying to yourself, I got this. So it starts with that, cognition. We like to identify that, and then we go to the emotions. The emotions can be several, they can be layered, or they can just be really strong on one or two emotions. Then next, we like to identify where in your body you feel that. And most people are a little bit surprised when I ask them that, like, you're feeling really guilty, right? Well, where do you feel that in your body? And they're like, first it doesn't make sense, but then when you take a half a second to reflect on it, you can usually think, well, I feel it in my stomach, or I feel it in my head, or different emotions have different places where they live in your body, but everybody's different. So it's important to get that right. And then we like to rate it on a scale from 0 to 10 and see how bad it is for you. And that helps us a lot, because as we're going through the process and you start to feel better, we want to know. Likewise, sometimes it might seem like a 4 or a 5, but as you get into it, it increases in intensity. So that's what we do. We identify the target, we slice it up in all these little dimensions, and then we start the procedure where we use eye movements. And there's also this idea that since the procedure's been out and used by folks, we've discovered that the eye movements work, but also bilateral stimulation, or stimulation to both sides of your body, right? As you know from anatomy class in college, whatever, that the left side of your brain is controlling your right hand, and your right side of your brain is controlling your left hand. No one really knows exactly why this works, but we got some theories. Anyhow, it can be done with hand taps. Some therapists have electronic tappers that they use to administer the stimulation to their clients. I tend to stick with the old-fashioned eye movements, although I use both. But this is what I usually use. This is my mentor, Barry Litt, gave me this thing, which he made from some auto part, I believe, tool chest. But basically, I'll have you look at this yellow cap, and I'll have you keep your head straight, but you move your eyes from side to side in what they call saccades, okay? We do a set of this, and I'll stop, have you take a breath, and just report to me any experiences that you're aware of that show up. And you know, these can be thoughts, feelings, it could be the number going up or down. And what I'm interested in is keeping you present, keeping you from dissociating, and recognizing when you do and bringing you back so we can process this information so that it goes from a 9 or a 10 down to a 1 or a 0. That's the goal. So I think that covers how it works roughly. And why does it work? Well, you know, that's an interesting one because nobody really knows. But there is one theory that I have always taken as something that really resonates with me, that makes a lot of sense. Okay, so this woman named Deborah Korn, she's a clinician, a psychologist, and a researcher. So she spends a lot of time doing research. Well, her husband is also a researcher. He's a scientist, works in a sleep lab. So he's a sleep researcher. And what he identified in becoming familiar with the technique that his wife was using regularly, he said, there's something that happens when you're sleeping and your eyes move back and forth in REM sleep, right? Rapid eye movement. So when you're dreaming and your eyes are moving back and forth, he says there's a neurotransmitter that's released in your brain, and what that neurotransmitter does is it helps you separate working memory from semantic memory. So working memory is like the fact of what happened and when it happened, a sequential thought, right? But then the semantic memory is the meaning, like what meaning did you attach to this situation that happened? And so what he found is that this neurotransmitter separates your brain's ability to review something without the meaning and the facts merged. Okay, it helps separate that. So you can review a situation and be free of the old tapes of it. We don't know for sure that this is why it works, but it seems like a pretty plausible explanation to me. So that's maybe one out of hopefully more that emerge over the years. And if you have any, please put them in the comments. And likewise, what else do you want to know about how it works or what it is? Yeah, leave me a comment. Otherwise, thanks for watching, and we will see you again soon.